Today I'm meeting with James K. Ott, LCSW, that's Licensed Clinical Social Worker. And before we launch into the subject we're going to talk about today, would you just give us your contact information, the name of your practice, if people want to give you a call?
Sure. My name is James Ott. I'm the LCSW, as you've heard, and I have a practice in the Trolley Corners building in downtown Salt Lake City, which is across the street from Trolley Square, and it's on the corner of 500 South and 7th East. My phone number is 801-556-6007.
And do you have a website or email address you want anyone to communicate with you using?
Yes. My practice is called Red Willow Counseling and Recovery, and the email address is james@redwillowcounseling.com, and my website is redwillowcounseling.com.
Thanks. So today we're going to talk about what?
What I thought would be helpful to talk about would be if you think your loved one, spouse, partner has an addiction problem.
Okay. And that's an excellent subject because people can tell their marriage is strained or going sour and they may not know what it is. And I frequently have people asking me, it's like, I think there's an affair, or I think that it's just, I think my spouse is gay and just now is finally, just can't take it anymore or keep it concealed. And oftentimes that may be true. Sometimes people's intuition is quite good, but other times it just may be that there's something else going on, maybe something good or something bad. What are the hallmarks of somebody who may be addicted or becoming addicted or abusing substances? And are we going to talk about just substances only, and we're not going to talk about pornography addictions in the context of this discussion?
I think pornography addictions fit in this context.
Okay, that'll be fine.
As part of the symptoms, but I am going to speak more about substances, especially because the impact it has on the brain and the addictive quality on the brain that these substances have. It's a little bit different with process addictions like gambling and food and sex and pornography and workaholism, these sorts of things.
Right, so that's good to know. So we're going to be speaking specifically or primarily on substance abuse.
Yes.
All right.
But there's some crossover.
Sure.
Yeah.
What kind of things what are some of the telltale signs, or is that where you want to begin?
Let's start there.
Okay.
What I want to stress here is how addiction is a disease. It's a disease in the same sense that we have an organ, which is the brain, which isn't working properly. Now, the interesting thing about that is the symptoms of this disease tend to be viewed as more character flaws or lack of moral character. If I have a cold, my symptoms are runny nose, sore throat, maybe a fever, these sorts of things. But whereas if I have an addiction issue, again, a defect in how my brain is working, my character flaws are going to be things like lying and manipulating. Families with a person with active addiction, there's a lot of chaos and confusion. Things kind of make sense, but they don't. When we question a person in active addiction, hey, where did that $200 go that you got from your bonus? There will be a very plausible excuse given that has enough truth to make you believe it, but then things don't quite stack up. And part of the difficulty here is when we're in a relationship, trust is such a big issue. And so we really want to trust that other person and want to believe that other person is being honest, and probably have a long history of trust and honesty.
Kind of like it takes two people to lie, someone to tell the lie and someone to believe it.
In a sense,
yes. So we almost kind of feel like we're in on it and don't like being manipulated.
Yeah, and, we want to believe the other person. We want to believe, hey, I have this loving, trusting, open relationship. But time and time again, these kind of half-truths start adding up, and we start to feel there's something really not making sense. So I think that is kind of the primary, in a sense, symptom of a partner having addiction, is the confusion, the lies and manipulation, and also just kind of a generalized chaos, a lot of busyness. I've got to be here, I've got to be there, this, that, what's going on, I'm staying late. And it can gradually happen so that we don't even realize how thick we are in it.
I would never have guessed the busyness. It makes sense when hearing you say it, but I unfortunately I haven't, at least not that I'm aware of, been involved in any kind of an addiction setting. But yeah, just kind of the busyness, the chaos, trying to either as an outgrowth of somebody dealing with addiction or somebody covering their tracks, or both.
Yes,
Interesting.
exactly. Yeah.
Okay. What do we do now then? I mean, how do you just confront it? Hey, are you addicted? What do we do?
Well, I'm going to touch on a little bit of the neurobiology.
Okay.
Because I think what happens is when we get caught in this addiction lifestyle, this active addiction lifestyle, we start to personalize it, especially as partners. You know, there's something wrong with me, or I should have seen this addiction, or why does he or she want to drink alcohol as opposed to be with me, or why is so-and-so spending our money on cocaine or heroin when we're going to lose the house now? There's a lack of love, there's a personalization about it. But this isn't accurate in the disease, which going back to why it is a disease. And I'm going to give just a little, thumbnail of how addiction is a disease of the brain. I really could probably talk for an hour more on this concept. But basically, there's a part of the brain called the midbrain that has to do with survival. It's also the pleasure center and has to do with fight or flight. So basically, when we find things that are enjoyable to us, we eat chocolate, we have sex, we are warm and comfortable, our brain is producing dopamine, which signals, oh, this is a really good thing, this helps us to survive. When we're in negative situations, when we're cold and wet, when we are at risk, you're walking down a dark alley, the brain is excreting a cortisol, which is the stress hormone, which tells us there's something wrong, get out of this, do something to survive. So there's this, this survival cortisol, and then this pleasure dopamine response that happens in the midbrain. Addictive substances respond to the dopamine receptors in the brain. So if I drink alcohol, I get a big dopamine boost. If I'm taking cocaine, if I'm snorting cocaine or shooting heroin or any of these other substances, I'm getting a huge dopamine boost. So over repeated use, my brain is equating this dopamine boost that I get from these substances with survival. So in a sense, when I take that away, if I stop drinking, my brain is signaling me there's something wrong here. You need to survive.
Yeah.
You need this
You're
to
at risk.
survive. You're at risk. And granted, this is the midbrain. This is when we have a reflex. If I'm touching a hot stove, I have that reflex. This is the same sort of response. It bypasses our whole frontal lobe, which is thinking, judgment, reasoning, consequential thinking, And so in that sense, our brain is signaling, don't drink. I'm sorry. So in that case, our brain is signaling, you got to drink to survive, but our frontal lobe is saying, don't drink, you're going to lose the house and the wife and the kids.
Or you're going to pass out.
Or you're going to pass out and
whatever,
get thrown in jail or whatever.
Yeah.
But that's how, in a sense, that midbrain can override our decision-making process.
Here's a question that just came to mind. So, I know it's obviously easier to have a few drinks than it is to go run a marathon and have dopamine released like that. But why is it so easy? Is it just because it's like gasoline is a great storer of energy, which is why it's so hard to get off gasoline-powered cars? Is because gas just does a great job of storing energy, and you can put it in tanks. And it's the same thing. There's no substitute for a nice stiff drink or a nice hit of drugs. It's just you can run a marathon, but who wants to do that? Is that really how simple? Or
well, yeah, we're talking about accelerated rates of dopamine. Yeah. Having a drink, we're getting a huge dopamine boost.
And just for bending your elbow.
Just for bending your elbow, whereas the effect, the impact it takes to go run a marathon or to work out or engage in meditation or this, you're not getting nearly the payoff, the bang for the buck, so to speak, the minutes per dopamine rush, you know.
Crying shame. I wish there was something.
Yeah.
But it is what it is.
Yeah.
Okay, so we know a little bit now about how, just that's a good point, is that it's not just I don't have enough self-control. I tend to condemn addiction the same way. It's like, well, hey, I'd like extra money. That doesn't mean I go hold up banks. That doesn't mean I rob little old ladies or stuff like that. So, hey, if you don't come crying to me about being an alcoholic or a drug addict, I mean, you're going to have to detoxify and stuff like that, but just have some moral fiber.
Yes.
It's harder than that because it's really hardwired.
It really gets to be hardwired.
The brain is screaming for it and making you suffer.
And it's overriding our consequential thinking, our judgment. And you know, this isn't to say that we should just not hold people with addiction accountable, because there is some choice involved. But I say this because it really complicates the issue. Again, instead of like buck up and stop drinking, you know, what's wrong with your character? We need to treat this as a disease, and there's a lot of help out there and a lot of successful treatment. Addiction treatment has a bad rap for poor outcomes, but really when you compare it to other diseases, so you compare things like diabetes or cancer, that in the same way are chronic life-threatening diseases. If we approach addiction treatment with that same commitment as we do cancer or diabetes, we have the same rates of outcome.
Right, and that's true. We don't really think of somebody who dies of cancer as just saying, he just didn't stick with the program. No, we blame the cancer. Now the cancer got him. Not that he didn't work hard enough, or not that he didn't drink enough cod liver oil or something. And maybe that's true. Maybe that person could have recovered if they'd have exercised a little bit more or eaten a different diet or something like that. But we don't usually. We just say, hey, the cancer was just too strong.
Exactly.
Sometimes.
But, and in the same sense, we don't get someone with cancer and treat them for 2 to 4 weeks and say, oh, you're off on your own. Oh, and the cancer came back. Well, you have a lack of moral fiber. And when we take people with addiction and we treat them with rigorous treatment for the first 30 to 60, maybe even 90 days, depending on the severity of the disease, we have follow-up care, we have lower levels of care, and we treat a person with addiction for 12 months as we do a cancer patient, we have remarkable levels of success.
It just occurred to me, too, that may be why Alcoholics Anonymous is saying, and groups like that, it's like, you stay on this for life, or at least for a very long time, because this is a disease that is not curable in most cases, and so it's just you're getting treatment.
Yes.
You're being responsible. It's not because you're so weak. It's like, oh, you're still going to AA after 10 years? No, I'm proud of the fact that I continue to go to AA after 10 years, and because it's helping me to stay on the wagon.
Imagine a diabetic who after 6 years of diabetes, why are you checking your blood sugars? What's wrong with you?
Aren't you? I mean, you've been doing great. And the other thing I was hearing is that apparently with AA, it's something like 1 out of 7 people actually sticks with the program or something like that.
Well, again, that's misleading. And
what I mean is that I'm not trying to suggest those 6 were just screw ups, but just like that. What's funny is that in cancer, same thing. A lot of people die of cancer, and those who survive are in many cases in the minority. They're 30% survival rates and things like that. We don't say, well, gee, 30% of the people survive, but he didn't, so I guess he's just a weak sister. Can't handle. I had not thought of it in that way. I guess I should have.
Yeah. Well, again, this is kind of we're really stuck in an old school of viewing addiction, and seeing people with addiction as lack of moral fiber and untreatable, poor success rates. When people follow the prescribed treatment, we have great success.
Now, you were also telling me when we were just getting ready to start about there are ways that a couple or a family can help someone to recover, or in some cases, if that's just not in the cards, short of having to break up the family, learning how to just manage or cope with it.
Mm-hmm.
Can we talk a little bit about that?
You bet. So again, there is treatment available, and there's various levels of care depending on the severity of the illness. So one of those, and the most famous, the most common is rehab or residential treatment. So where a person will go into a facility for 30, 60, 90 days, right? And the length of time should be determined by the treatment providers and how well they're responding to the treatment in the facility. And the better they respond to that, the quicker we can get them into a lower level of care.
Let me ask this. There are good schools and bad schools, and there are places that'll basically sell you a diploma, but they're not accredited and things like that, and they play on the ignorance of their students and things like that. I've never dealt with this personally myself, but are there care facilities and rehabilitation facilities that are similar?
Absolutely.
Where they'll promise you results they can't possibly deliver, whether it's cheap or exorbitantly priced? I mean, can we talk a little bit about how would you know if you're finding a good program? Knowing that, of course, you have to do your part, but still, even the most dedicated person could go to a crappy facility, and that could be the difference between recovery and not. So, what do you look for?
Well, a couple of things. First off, there is an accreditation body called the Joint Commission on Accreditation. It also accreditates hospitals and other healthcare organizations. Treatment centers now are getting accredited through the Joint Commission, and that has somewhat of a stamp of approval. You're going to want to know the competency of the staff.
Can you put any faith in the accrediting, or is it
somewhat?
They're an accrediting body, but wave enough money under. I'm not trying to be overly cynical, but it's like, well, we're accredited. It's like, yeah, I can get accredited, or is it pretty rigorous?
No, it's fairly rigorous.
It is, okay.
And there are certain standards that have to be met, and there is an ongoing review.
Okay.
And so, you have to continually meet these reviews, or you could get off the list.
Okay.
Right? You also want to look at the level of competency among the staff. If you have a lot of junior level therapists that don't really know much about addiction, or they're right out of graduate school, then it's questionable. If you have therapists that have been in substance abuse treatment for a number of years, some junior level therapists is fine, but as long as there's having a mentorship, somebody with some seniority and experience to kind of guide them and direct them in their work.
One thing I notice that there's a lot of people that think that if a lawyer has a law license, then he or she is just as competent as everybody else.
Yeah.
And I'm surprised how much people that aren't doctors, lawyers, accountants think that we're all the same. We're clearly not. So how do I mean, hey, gee, you went to the University of Nebraska. Never heard of it. This guy went to Harvard. I guess I'll just stick with Mr. Harvard. And there are some things, I guess, that may give indications, but what would be some things that people could really sink their teeth into about knowing they've got a good facility and that they've got good staff?
To tell you the truth, that's the word of mouth reputation. That's, you need to have all these pieces.
Let me stop you there because I'll tell you this. I'm a divorce lawyer, for people watching this that don't know that. And I've actually found that word of mouth is a terrible indicator. In law, other things it makes some sense. But I've heard gushing things said about terrible lawyers. And my theories are many, but one of them I think is just, it's kind of an honor among thieves idea. If I don't say anything bad about you, you won't say anything bad about me. And even though I'm way better than you, or you're way better than me, we'll just kind of keep the peace by saying good things about each other. I would think that would happen in the mental health community too. Am I wrong?
I would imagine that
he did not know this question was coming, by the way. So if he's feeling uncomfortable, I apologize. But
I would imagine there might be some truth to that, but honestly, so a couple of things here. It does depend where you're getting that word of mouth recommendation from. But there are people out there that are specifically, trained, but have the experience and the job position to do these referrals. Now, I'm sure some of these, have favorite treatment centers that they refer to, and so you can get into that. But really, our field has a pretty strong ethical guidelines centered around this. And number one, any referral person should not be getting any sort of kickback. So if someone comes to me and I say, I think you go best at X treatment center, then if I'm getting a kickback from that, not only am I biased, but ethically it's pretty bad for me. And if it got out in the recovery community that I was doing that, I would be approached by several of my colleagues about.
But it's not something you can lose a license over then, is that right?
No, not necessarily.
Yeah, see, lawyers can. Lawyers
Yeah.
can't accept those, but you're saying, so, in other words, just because somebody gets a kickback doesn't mean that guy's gonna be out of business. In fact, that could be keeping someone in business.
Not necessarily, but I think the long-term effect is no one's going to refer to that person.
Yeah, but still,
You
my
know.
point is that that's not going to be something that gets that person out of the profession.
Yes.
That person's not gonna lose a license.
No. And so, but you do have these consultants. They're usually called educational consultants or therapeutic consultants. Interventionists also have a strong knowledge of treatment centers and are pretty good referral sources. And honestly, in the state of Utah, we have really some pretty good referral bases out there of people who can refer on an unbiased basis.
What about checking disciplinary records and things like that with the Department of Licensing? Is
That may have some merit, but really it's more, going to these professionals who
Mhm.
refer. The other piece here is kind of a knowledge around people in recovery itself. If you have an in with a person who has gone to recovery, they usually know who the good therapists are, who the good interventionists are, who some good referral sources, what the good treatment centers are. So this goes back to the word of mouth.
I presume, though, that that's hard to do because you have to figure out, or someone has to volunteer to you, I'm a recovering addict, because you can't just ask a therapist or counselor, tell me who your 3 greatest success stories have been because of confidentiality
Sure.
and privilege.
Yeah.
Let me ask you this. In law, for example, how much one charges is not the best, in my opinion, indicator of one's competence or expertise. You can have people that are terrible at the job charging $300-400 an hour, and they're not very good, and you can have people charging far too little, in my opinion, $75 or $100 an hour, and they're excellent.
Mhm.
It's the same thing happened with, is what people charge a good gauge of competence and ability or not?
Probably not. no.
Probably not?
Yeah.
Okay.
I mean, to some extent, but there are those people who are popular and who charge a lot of money that they're okay. They're okay. But it doesn't necessarily reflect that their competence.
Let me slightly shift gears and say, how long should you stick with somebody before, assuming that you're doing your part, how long should you stick with somebody before you say, this isn't working, and it's my therapist who's the bad fit, not me? Now, granted, maybe you're working as hard as you can, but the therapist just rubs you the wrong way. But I'm talking about somebody where you determine this therapist is not good, or at least not good for me. How long do you think people should give generally? And if not an actual amount of time, kind of give me a formula for when you just realize it's okay to quit this therapist. You're not a failure. It's this therapist-patient relationship that's failing you.
Yes. If I were to go find a therapist, someone who could give me some ideas about my spouse's addiction issues, right, this sort of thing, I would call up probably 3 to 5 different therapists that I find online who say they know addiction. I would say, my spouse has an addiction problem. What can you do to help me? From that, I would probably choose 2, maybe just 1, and go to that person and give them a trial run of 2 to 4 sessions. If it's not working for you, if you don't feel the therapist is competent, if you don't feel the therapist is a good fit, because you need both, then I would go somewhere else. If that therapist has an issue, takes that personal, that's a really good indicator it's a bad therapist, right? Because as a therapist, your job, you're being employed by the client to provide a service. And so if I'm not providing a good service, it's my ethical responsibility to find someone who can. And if that person decides that I'm not a good fit, then, and I take it personal, again, that's my problem as a therapist as opposed to the client.
And that's a good point, because there can be people that are excellent tailors who tend to tailor everything rather close and tight-fitting. And if I'm a tight-fitting kind of guy, I'm gonna tell everybody what a wonderful tailor I have. If you're kind of a more of a looser fit person, you're gonna go to that tailor and go, "This is terrible." That doesn't make that person a bad tailor. It just means that you don't particularly like that. It's a matter of taste.
Exactly.
So that's interesting, because again, not all lawyers are the same. Not all lawyers that are good at their job are going to necessarily please everybody that comes to see them. Therapists would be the same way.
Yeah, exactly.
So you as the patient also don't need to feel like you're a failure if you're just not clicking with that therapist, because
Yeah.
it could really just mean I don't understand him or her, or he or she doesn't appear to understand me.
Yeah. It's a little more difficult because therapy is so personal, and you do get vulnerable, and there's this personal connection.
Right.
But underneath it all, the client is employing a person to perform a service. You know, the same way if I needed some kitchen cabinets and I hired a cabinet maker or a contractor to come in, and if I didn't like what they were proposing, or if I didn't like what they were doing, I could fire them and find someone else that did the right job.
And if I know I need my house painted, I might just give up if I just think the first house painter I called just didn't seem to click with me. My house goes unpainted.
Exactly.
Get the treatment. Don't give up on
Yeah.
treatment just because you may not have had a good experience with that
Exactly.
therapist. But how many times do you get to quit before you realize, no, it's not the therapist, it's me?
Well, probably if you're going through, definitely by 3 therapists, if you're having the same experience, then we need to start looking into
Now that's interesting you'd mention 3, because if you go online, you'll read about how do I pick a good divorce lawyer, and you'll see, talk to 2 or 3. And my advice to people is, no, talk to like 8 or 10.
Yeah.
And the reason I say that is because I just have a very low opinion of a lot of divorce lawyers. They're out for the money. They're kind of lazy. Divorce lawyers generally don't have to be very competent. But you're saying the level of competency, at least in the Salt Lake Valley, is such that after about 3, you should know that you're dealing
Yeah. I think if you've engaged in therapy,
Yeah, assuming that you're doing your
Yeah.
part and you're doing it in good faith.
calling 8 or 9 therapists is probably a great idea. You know.
Okay.
5 would be kind of, again, I said 3 to 5.
So you're kind of,
but-
in other words, you're feeling a little more comfortable now that I've said that.
Yeah.
Okay, good. So.
Well, again, calling 3 to 5, that's kind of the bare minimum. But if you were calling, 5 to 8 therapists, then that would be even better.
And that's going to take more time, and that's going to cost you more money. But what kind of a payoff are you going to get?
Yeah. A lot of therapists will do a free phone consultation, 10 minutes.
Do you guys get a lot of people just fishing around for free stuff all the time?
Sometimes, but
Okay.
not a lot.
So-
I've
so-
encountered that very little.
Okay, so looking around and going to 3 to 5 to 6 or 7 isn't going to necessarily rub everybody the wrong way.
If someone called me and I talked to them for 10 minutes, that's not a problem. If people came in for a 30 or 60-minute consultation and didn't want to pay, then yeah, I would say, I'm happy to talk to you on the phone, but if you want to come in and do a 30 or 60-minute session, I would ask for some payment.
Let's assume that I really want to make things work, and I want to get started as quickly as possible, and I want to make the best choice. So I decided I was going to talk to at least 5 people. And I was convinced that 10 minutes may or may not be enough, so I'm going to go and see somebody. And I don't want to just talk over the phone. I want to get to see someone's mannerisms
Yes.
and demeanor. What's it going to cost me to go visit 5 people for half an hour apiece in general?
Probably a therapist that's got a decent amount of experience.
Yes, that's what I'm
You
saying.
know.
Good people that I understand are not the cheapest,
Yeah.
not necessarily the most expensive, but I've decided it is worth it to me. I'm going to spend this money. I'll never get it back.
Yeah.
But the idea here is that I'm going to save money in the long run,
Yeah.
and feel better faster in the long run because I did my homework and made that effort up front.
Yeah.
I'm going to go see 5 people. What should I budget for that?
$85 to $120 a session. Some therapists charge $150 or even more.
So about $600 at the high end,
Yeah.
and about $400 to $500.
Yeah.
That's not much of a spread.
No.
So about $500 to $600.
Yeah.
But that should, I get the feeling.
You should have a very, very good idea by then. An excellent idea.
All right. Some people are very embarrassed about going to a therapist. Do most therapists just accept cash payments so that there's no insurance record or trail
Right.
like that?
Well, would you refuse cash?
Well, I don't have any insurance problems to worry about, and so
Yeah.
you'd be amazed the kind of questions that come up. You know,
Yeah.
some people are afraid. Well, let me give you an example. I have a timeshare at Snowbird. Okay, for years I've gone there. I love it. I didn't know I had access to the spa. It was free access. So for years I never went up there.
Yeah.
And then one day I was just thinking, boy, it sure would be nice to go to the spa. Maybe I should splurge this time. And I finally realized, they're like, oh, well, you know, you have a timeshare? I was like, yeah. Well, you have access to all this for free. And I've always had it.
Yeah.
Same thing, a lot of people are thinking, well, you know, I don't want my insurance. They think they can't go see somebody without
Yeah,
insurance.
yeah.
So you can go to almost any therapist would say, yeah, I understand. Just go ahead and pay me
Yeah.
cash, not even check, so there's no record. I mean, you keep a record of the meeting, but there's no
Yeah.
paper trail that person could be embarrassed by.
By law, we have to keep our own client records.
But there's no, my insurance
There's
company doesn't
no-
find out, so therefore my spouse doesn't find out, therefore my employer doesn't find out, or
That's
anything
right.
like that.
That's right. There's no central database that all these records go into, and so I can type in, you know, James Ott, and there's all
And
my,
then all the list of everybody
right,
that's
there's
ever
a list
seen
of
you.
everything. There's no centralized list. There's no centralized database, and especially if you pay cash, then it's only in the records, and so
Right.
unless that person knows that you have gone to this therapist and then can therefore subpoena the court records, you're not going to know. I mean, if you're seeing a therapist, and I know you're seeing a therapist, but I don't know who you're seeing, I can't subpoena any records of who I don't know, right?
Right. Real quickly, most people watching this aren't going to be in that situation. What do you have to report if somebody comes to you paying cash? There's a few things I think I'm aware of, but I wanted to just ask
Yeah.
you.
I
Now,
have-
remember, I'm an alcoholic in this case. I'm not really an alcoholic, but I'm an alcoholic. I'm talking to you. You can't report that.
No.
What do I have to do for you to say, no, well, it's not confidential anymore?
Yeah.
What kind of things would I have to do?
So
or something?
things that aren't confidential. If you're threatening to harm yourself or kill yourself, if you're threatening to harm or kill someone else, if you're having sex with a minor, if you're abusing the elderly, I have to report that. Any court subpoenas, I have to then reveal my records. And some people don't know, but with the Patriot Act, a law enforcement officer can come into my office and ask to seize the records of so-and-so person.
If you have such records.
If I have such records, and so they would have to know that, you know, Bob Smith sees me in therapy, and they could, under the Patriot Act, like a marshal could come in and say, I want to see Bob Smith's clinical
Do they have to
records."
know Bob Smith has records there, or can they ask you if Bob Smith has records there?
They could ask with the
And then-
Patriot Act.
And then you have an obligation
the
to tell
Patriot
them
Act
the truth.
is pretty revealing.
Wow, I didn't know that.
Yeah, it's kind of an interesting.
So it's not carte blanche. I can't go in there and say, or if I really am feeling suicidal, then I run the risk of you reporting that.
Yes.
But what I ought not do is just do that to play on your feelings. Sometimes I just want to kill myself. I don't really want to kill myself.
No.
I shouldn't tell James that I want to do that because
Well, as a therapist, we make some judgments about intention, means, plans, these sorts of things. I mean, there's one thing of like, oh, this guy cut me off and I want to kill him. I wanted to kill him, you know, in traffic,
Right.
you know. Or I saw this guy cut me off in traffic. I got his license plate number. I found out where he lives. I went and bought a gun. You know,
Let's take
there's
the
a
place
huge
out. He leaves every
difference.
morning at 7:30.
Exactly. There's a
Okay.
huge difference there.
All right.
I
Yeah.
think it might be helpful to go back and talk about maybe some of the treatment we're talking
That's
about.
what I'd
with-
like to do too, and just go
Yeah.
individual or family, and when that's a good idea or not, or whatever
So-
route you want to go.
Well, so we talked about rehab, and so part of this is the therapeutic component. So there's rehab, there's outpatient groups available, where, you know, rehab, you're living in a facility. Outpatient groups, usually you're engaging in life, going to your job or whatever, and then in the evening you'll go to some groups, about 10 hours of therapy a week. And there's individual therapy. There's another important piece is the 12-step program.
And if you wouldn't mind, also add to that, there's that ad on TV that I've seen where it's therapy online. Now, it sounds a little funny to me, but I don't want to knock it.
There are some teletherapy groups out there, and they surprisingly, the data shows that they can be remarkably effective.
Well, great, but I don't want to interrupt your train of thought. So, you talked about you want to start with residential and then move on to outpatient and then group and.
So there's the residential where you live in the facility.
We talked a little bit about that. Make sure you're not just wasting your money, wasting your time.
There's the outpatient groups where you live at home, you're sleeping there, you might go to your job, and then in the evenings go to the group. Usually that's about 10 hours a week. Individual therapy or family therapy.
Is that 10 hours a week, 5 days a week, or 10 hours a week, 7 days a week?
10 hours a week, depending on certain programs. Some programs have 5 2-hour groups, 4 2.5 hour groups, 3 3-hour groups. So it just kind of depends. Medication, it can be a very important part of the recovery process, whether that's medications to stabilize your mood or lift your depression, decrease your anxiety. Some medications are available for people with addiction. So there might be there are some medications out there for like decreasing cravings for heroin, decreasing cravings for alcohol. These sorts of things are available. That's something to look at. Individual therapy can be very helpful. That's like an hour once or twice a week. Sometimes you bring in your family members or your spouse with that. I mentioned 12-step groups. Sometimes religious-based groups is important. Spirituality has shown to be a very important concept in addiction. To me, spirituality has to do a lot with forgiveness, forgiving others, especially forgiving yourself, letting go of shame and guilt that's involved, acknowledging and taking responsibility for your actions and damage that's been done, and receiving forgiveness for that from, again, yourself and others. Whether that's, religious-based, but more it has to do with your relationship with God or a higher power. So these are all components of getting well, getting healthy with the addiction.
How does somebody know what the right course of treatment is for him or her? Do you go into a residential program and say, well, this is probably the most involved, so if regardless of how bad it is, this is obviously going to help. Is that true? I mean, if I have a mild case of something where I'm addicted, but I'm not just consumed by it, could it be bad for me to be in a residential program?
So I'm going to go back.
Do you see what I'm asking?
Yeah. I'm going to go back to the example of someone with cancer or diabetes, right? That would normally be detected with a doctor, right? The doctor would then refer you to the appropriate level of treatment. And so in that same sense, a good addiction therapist, you would come in and say, this is what's going on in my life, and a good addiction therapist would be able to refer you to various levels of treatment depending on the severity.
Not just a one-size-fits-all kind of thing. The reason I ask is thank you for coming here. Yes, you clearly have some problem, and you do. That person's not a charlatan. So you want to come here and you want to spend $20,000 on a residential. Okay, sure. We're not going to stop you. I mean, that's not what they would do.
No, that's like you saying, I've got a little spot on my wrist. I'm going to go up to the Cancer Institute, the Huntsman,
right,
and get admitted for a month. It's like, no, let's go to the doctor. Let's do some tests. Let's find out what it is and get you to the appropriate level of treatment.
Yeah, see, because there's a lot of lawyers that would not. They'd go, you want to give me all that money? And you want to hire all these experts? I don't think they're going to do any good, but sure. Hey, because it'll keep me. Okay, so that's good to know.
Yeah.
That's good to know.
Yeah.
I'm a very cynical guy.
Yeah.
All right. Yeah. Briefly, then, let's talk about group and then what you call it, teletherapy?
Teletherapy.
Okay, so let's talk about group. From what I can tell, Alcoholics Anonymous and its outgrowths, which were started by people that weren't mental health experts, got it pretty much right about 90% of the time, didn't they?
Yes.
So most people say they're doing a great job. Anything to worry about? Anything to watch out for when going to some kind of a group setting?
So when we talk about group, there's two types of group.
That's
right?
what I'm talking about, right?
Self-help groups are groups run primarily just by the participants themselves. There's no, in a sense, professional staff. These groups are very helpful with the support that they give. 12-step groups are very well known for kind of really accepting anybody who wants to come. You only have to have a desire to get sober to be there. People can be fully drunk and come to group because they have a desire and still receive support. The other types of groups that are offered, such as the outpatient groups or maybe some kind of clinical type groups run by a professional, they're more, again, that professional. Self-help is free. The clinical groups, usually there's some cost involved, whether you pay cash or insurance.
What are you getting for your money?
Well, there's different things. There's, in a sense, you get things from one group that you can't get from the other, and vice versa. Self-help groups, again, have a lot of that community involvement. You can get a lot of support. Oftentimes you get a sponsor. You wake up at 1 in the morning, or you're out at 1 or 2 in the morning, and you're in trouble. You call your sponsor. You get immediate support, right? There's a lot of acceptance, and gosh, all these people are just like me. Clinical groups, you're going to get more of psychotherapeutic, we call it processing, where you're talking about whatever's going on within you to, in a sense, perpetuate the addiction.
So you're being more directed without maybe even realizing it. You're going to a group, but that therapist or that person heading it is, what would be an example? I guess it'd be getting exercise while having fun playing soccer. Kids don't think they're actually getting physically fit. They just are having a good time playing soccer, but it's all part of...
Well, so the process groups too, they're more challenging. People are going to go there and, I'm having difficulty with my wife, and a therapist will say, well, what's your part in it? Well, what have you looked at this and that, and can you see it from your wife's point of view in this? If I go to a self-help group and say I'm having problems with my wife, and then people will say, you're really struggling with your addiction, and let's support you. And not necessarily validate you in a sense, but it's not nearly as challenging or confrontational, or let's look at yourself.
If I've got cancer and they say you're on this treatment regimen, and I go off and do something on my own, I may end up making it worse. Is the same thing with this kind of psychological therapy? Like, my doctor or my therapist tells me this is what you need to do, but then I go off and join some other group or some other, can I be doing damage? Let's assume that they're all taught by people they're all run by people that are licensed, or it's a decent AA group.
Sure.
Can I still be doing harm? Should I be telling you, if you're the one that's my therapist, everything I'm doing?
AA groups, 12-step groups, don't really necessarily tell you what to do, except centered around the step work.
Mm-hmm.
You have the 12 steps, and they will guide you through those step process, but you're still doing a lot of that internal questioning.
And I get the feeling that's that's compatible with almost anything.
Yes.
Right? Okay.
Yeah, it really is.
But
so they're not really, there is some guidance, there is some, are you sure it's good to go to the bar with your friends to celebrate your friend's birthday, that sort of thing. You're going to get that in the process group as well, but you're going to get more community support as opposed to challenging and guiding.
I'm talking about anything then. But should my therapist know what I'm doing, just so that I don't inadvertently do something where I'm mixing medications?
Oh, absolutely. A therapist, should be referring you to a 12-step group. Again, there's different strengths and weaknesses with each one of those. And so they complement each other well, and they kind of fill in the gap.
Can you get too much treatment?
At some point, probably, but you look at the final result. Are you still drinking? Well, you're not getting too much treatment if you're still drinking.
How about this? In a family situation, should the family be involved in the treatment in all cases?
I'm not a absolutist, so I wouldn't ever say all, but I would probably say 99% of the cases. Addiction is a disease, it's also a family systems problem. So usually it's not just the person with addiction that has the issue. Usually there might be dad is the alcoholic, mom might be the enabler, this son might be the hero, this daughter might be the scapegoat. And so you need to look at the whole family and what's going on, how it perpetuates itself. I mean, kind of the common stereotypical thought is like, well, if you take dad and he goes off and gets sober and they come back in the family system, nothing's changed, then dad's changed, his roles, and that makes everyone else feel funny. So soon, at some point, mom goes and buys a 6-pack of beer and leaves it in the fridge, for the guests, and dad ends up relapsing.
Or dad never relapses, but mom still has to deal with her issues, and so she may do something foolish. Or son, the hero, still likes that role, whether it's good for him or not, needs to adapt.
Well, people don't, it feels funny to stay in those old roles.
Yeah.
And so either dad needs to shift back to his old role, or
that's what I mean. Or they've got to change their.
Change.
So if dad changes, everybody else has got to change who's been affected by it. And you're saying, I believe, 99% of the time, everybody is affected.
Yes.
That's really interesting.
Yeah.
Well, I've learned a lot, and I've learned some things that I'd never even thought were questions in my mind. I'm confident that people watching have felt the same way too. I appreciate you taking the time with us, and before we end, please just, again, give us your name, your contact information, your practice, so those that want to get a hold of you can do so easily.
Oh, I'm very happy to.
All right.
And thank you for taking the time. It's been a pleasure
My
talking.
pleasure. So, go ahead, tell us that.
So, again, my name is James Ott. I'm a licensed clinical social worker. I specialize, I work with people with mental health, but also specializing with addiction. My practice is called Red Willow Counseling and Recovery. I'm located in the Trolley Corners building across from Trolley Square on the corner of 500 South and 700 East. My phone number is 801-556-6007, and my website is redwillowcounseling.com, and with the email address of james@redwillowcounseling.com.
Thanks again.
Thank you for having me.